Ready to go?
Ready to go.
All right. Hi, everybody. I'm Dr. Groves. I'm excited to be back with you this week. It's Friday, lunchtime, and we've got a great new talk for you today. We're going to talk about 10 things you maybe thought you knew about pelvic and vaginal health, or maybe you were just too scared to ask. So we're going to jump right in, and the first topic is, our slides aren't going forward. Allie, can you help us out with that? All right, just a sec. Well, hopefully you got to see my previous talk on women's sexual health and the barriers to it. But if not, and you're tuning in for the first time, I'm Dr. Kira Groves, and I'm a family medicine doc right here at Memorial. I work over at the Astor Street Clinic. I am taking patients in case anybody listening needs a new doctor. In just a sec, we're going to get started with our talk on 10 things you thought you knew or were scared to ask about pelvic and vaginal health. Maybe you need to click back into it since you clicked out of it for the others. All right. So our first topic today is going to be, where is the vagina? And that maybe seems like a little bit of a silly thing to say. Do you really know where your vagina is? Unfortunately, studies have shown that up to 50% of women actually don't know where their vagina is or are confused about what it is. So that's going to be the very first thing we're going to talk about. This is a little diagram of kind of what the external female genitals look like. And our arrow is pointing at the spot where it is the vagina. Now, the whole external area, ladies, is not the vagina. A lot of people call it their vagina, but the vagina is specifically the tube that connects your uterus to the outside. So the area, again, in the picture is kind of pointing to where the vagina is. That's the opening. So what are all the parts, and what does each part do? That's going to be our next topic about things people may not be sure about. So there's a correct name for each part, and we're going to go over it and kind of what it does and where it's at. The first thing is, what is the actual name for all of our outside parts if it's not the vagina? And the actual right name for those is the vulva. That's the correct name for all of the external female genital area. It contains the other parts, the labia, the clitoris, and the opening of the vagina. It's also where the urethra comes out. That's not technically part of the genitals, but it does come out in the same spot. So what are the labia then? The labia are the thick outer skin folds. They're what you can see, first of all, if you were naked. It's where the pubic hair grows. They're not as sensitive. They're very protective. That's their main job. And then inside those, there's thinner skin folds. Those are called the labia minora. They usually don't have hair growing on them. They surround the clitoris at the top and then go down on either side of the vaginal opening in the back. The clitoris, which we just mentioned, is a small organ with very, very sensitive tissue. It's located just inside the top of the inner labia. It has the most nerve endings of anywhere on any body, male or female. Actually, the clitoris itself has about the same number or a few more nerve endings than the entirety of any guy's penis. So this is a super sensitive spot, and its only function is for sexual stimulation. It doesn't do anything else except that. The vagina, which is what we were talking about in the first place, is a muscular tube. It's just a tube made out of, lined with muscles that connects your uterus to that outer vulva area. This is where sexual intercourse happens. This is where sperm's got to go through to get up to the uterus to make somebody pregnant. It's where menstrual blood comes out of, and it is where a baby's going to come out of when a baby's born. So all of that happens coming through the vagina. One end is at the top by the uterus. That's where the cervix is at. And the other end opens to the outside. It's partially covered by the hymen. Originally, when women are first born and are children growing up in adolescence, the hymen, people think of it as being disrupted during the first time someone has sexual intercourse, but very frequently it's torn or damaged before that, just by physical activity, exercise, things like horseback riding, bike riding, using a tampon. Any of those things can have torn the hymen initially. All of those things together really make up the female genital area and the female pelvic and genital tract. So here's a diagram of a cross-section of a woman's body. The outer part there, where you can see the curve in the front, that is the entire vulva. It's made up of that outer labia majora that's labeled, the inner labia minora at the top, there's the clitoris, and then kind of right in the back middle, there's that opening of the vagina. You can see the little hymen is labeled. That vagina is that muscular tube that goes all the way up and ends at that cervix that you can see. As you can see, it's close to a lot of other things. One thing to notice is that right in front of the vagina, of the opening to the vagina, is where the urethra comes out. The urethra is the tube that carries urine out of the bladder. So I think some people are confused as to where women actually urinate from. Does urine come out of the vagina? It doesn't. It comes out of the urethra right in front of the vagina. So it is close by, but it's not the same space. And I think that confusion is what's led some people to wonder why, if women can hold their urine, they can't hold their period blood. It's because they come out of entirely separate tubes, and there's no little sphincter, no ability to close off the vagina and hold it tight. So women absolutely cannot hold or stop their period blood. It's a direct opening, and it's going to come out when it's ready. All right, so now we know what a vagina is, where it's at, all the things that are around it. Let's talk about something that's a little sensitive for a lot of ladies. What should your vulva and your vagina look like? A lot of people really worried, do I look normal down there? Is there something wrong with the way I look? Do I need to do something to change it? Well, so good news. There's a lot of ways to be normal. Here's some of the things that are completely normal for all of you ladies. It is normal to have pubic hair growing all over the pubic mound, the external labia, even down the thighs some. That's all normal. Lots of women want to shave off their pubic hair, wax it, anything else. And that's fine if that's your choice for appearance purposes. But pubic hair is normal, ladies. What else is normal? Those internal labia that we mentioned, the smaller internal lips, they can be longer or shorter inside or outside the external labia. Lots of people, I think, look in the mirror and think, does that look wrong? Does that look weird? Am I wrong down there? You're really not. They may not look exactly the same on either side. I once heard a gynecologist say that the labia were supposed to be sisters, not twins, and it was fine if they weren't identical. I thought that was pretty great. They should have probably either a pinkish or purplish tint to them, depending on your skin tone. Some may be more brown or tan, just kind of depending on your base skin color. Those internal labia and the opening to the vagina will be kind of a little ruffly or ridged, and they'll be kind of moist. They'll produce some of their own mucus and keep things moist. All of that's completely normal, ladies. Again, there's a huge variety of normal down there. If you're concerned that you're not normal, you can always talk with your doctor about it. But know that if you're looking in the mirror and things look healthy and you're just concerned if you're okay, if you look normal, you're probably normal. All right, next big question, and something that there has been an entire industry built around a misconception of. Does the vagina need to be cleaned? Is it dirty? Is it smelly and we need to make it smell like roses? The answer to all of those things is no. You don't need to douche. You don't need to use feminine wash or feminine spray. There's nothing wrong with the way your vagina actually exists. It cleans itself. It's self-cleaning. It produces mucus to flush it from the inside, and it does not need any other products added back to it. All of these over-the-counter products, like you can see in this picture, pretty much without exception, all of those are harmful to you. Your vagina is supposed to have a very specific pH, which is acidity. It's around 4. That's about as acidic as tomato juice, so it's kind of acidic. It needs to stay that way for health purposes. It's supposed to have some specific bacteria growing there, just like our skin does on the outside. Our vagina is supposed to have some certain helpful bacteria growing in it. And if we start using these over-the-counter washes, those will be killed off, and they'll leave the stage open for really harmful bacteria and yeast to come in. So we don't need to be using any of these products, ladies. The only time you should be putting anything for treatment or cleaning purposes into your vagina is if your doctor prescribes you something for an infection or dryness or something like that. But otherwise, there's nothing you need to do to clean your vagina. For the outer area, the vulva, it can be washed gently with soap and water. I would use a really mild soap, something unscented like Dove or Neutrogena. Really, you don't even need that. You can just use water. But I know sometimes after periods or, after being really sweaty, people want to use something to wash the external area, and that's all right as long as you're using a gentle soap and rinsing very well. Feminine wipes or sprays are really not a good idea either. Even in that external area, they create a lot of irritation usually. I see so many allergic reactions that people are worried are an infection when it's just an allergic reaction or a sensitivity to the harsh chemicals that are in these products. If you really need to clean up, again, after a period or after being very sweaty or anything else, something like an unscented baby wipe is going to be your best choice. All right, so if we don't need to be washing it out, how do we keep the vagina and the vulva healthy? There's a lot of misconceptions about this too, ladies. Do we need to shave to keep it clean? I kind of already answered this one, but absolutely not. Shaving does not make your genital area cleaner. If you like the way it looks, if your partner does, that's fine. That's something y'all can negotiate on and decide if it's comfortable and good for you. But it is not keeping you clean. It's not decreasing your risk of infection. It actually slightly increases your risk for either infection or skin problems because it can lead to ingrown hairs. It can cause skin necks that leave you open to infection. So that is not something that's keeping you healthy. If you prefer it, you may have to work through some issues if it causes it. What about the whole cotton underwear thing? Maybe Granny told you, you need to wear white cotton underwear to keep yourself clean. You know, even some doctors I've seen counsel women about wearing cotton underwear. We don't have good evidence for that, though. They have actually done studies on it, and there's no evidence that cotton underwear have a special virtue. Now, correctly fitted underwear and underwear that lets you have enough breathability or air movement are important. So if you're wearing underwear and you always feel sweaty and uncomfortable, or if they're cutting into your skin, those are definitely a problem. But correctly fitting underwear are close to all the same. If you have a lot of vaginal discharge normally, and it's normal and your doctor said it's fine, but you just notice a lot of it, or if you have a lot of sweating, cotton may be easier to live with due to breathability, due to better airflow through cotton material. Other alternatives, though, are moisture wicking fabric, and that is equally healthy and safe. All right, last big myth in this area. Can what you eat really affect your vagina? Can it keep you healthy down there? I've heard women say, oh yeah, I eat yogurt every day so that I won't get yeast infections, or I can't eat sugar, I'm going to get a yeast infection, or I've been eating lots of pineapple so that I'll smell better down there. Really, if you are otherwise healthy, ladies, nothing you eat is going to directly affect your vagina at all. It's not going to change the smell. It's not going to prevent or cause an infection. In a healthy woman, nothing you eat directly impacts your vagina. There is an exception to that. If you are diabetic, eating lots of sugar can increase the sugar in your urine, which can increase the risk of a yeast or other infection in that area. But if you don't have diabetes, definitely no direct impact. Even if you have diabetes, only the overall sugar content is really a big deal. Pineapple is delicious, and it is also healthy, so I recommend in general, but just know you're not going to have a big change in smell or taste down there. What should we do instead of those things? If those don't work, what can we do? Well, I already mentioned, but don't put any over-the-counter products into your vagina. Those significantly predispose people to infections, things like bacterial vaginosis, chemical irritation, yeast infection. They even leave you at increased risk of sexually transmitted infection. I would even really include things like spermicides in that list of things not to put in there. I know sometimes women use them as a contraceptive, and that's what they're intended for. But there are so many good contraceptive options. If you have other options, I would consider them first because they definitely increase your risk of vaginal irritation, vaginal pain, and other infections. Make sure on that note that you are using safe sexual practices because that is really the biggest thing leading to problems in the vagina and vulva is sexually transmitted infection, sexual pain, other things that are going to cause problems in your vaginal and pelvic area are often going to come from sexual practices. So make sure you're using safe sexual practices. Do in general eat a healthy diet and stay active. Even though what you put in your mouth doesn't directly affect your vagina right away, it does affect your overall health. And so eating a healthy diet with lots of fruits and vegetables, lots of whole grains, about the right amount of calories, a balanced diet with not too much fat, sugar, or protein, but keeping them all really nicely balanced will keep your body healthier overall. And as your overall body is healthy, your pelvic health and your vaginal health will improve too. And then staying active increases everybody's ability to enjoy any sort of physical activity like sexual activity. So staying active is always good for pelvic, vaginal, and sexual health too. And then the last thing I would really recommend is seeing your doctor for checkups. If you have something you're concerned about, bring it to your doc and talk to him. If you think everything's fine, but you just want to make sure you keep things going well, check in for those yearly well woman visits and make sure everything's going okay. All right. Can the vagina get out of shape? Now, do I mean that it hasn't been lifting enough dumbbells? No, that's not what I mean. But I've heard a lot of people say things like, oh yeah, her vagina really got loose after a while. And is that really true? Does that really happen? Well, not exactly. Remember that the vagina is a muscular tube. It's just a lot of muscles wrapping around a soft tube. And when there's nothing going on with the vagina, it's naturally closed. And nothing really changes the shape of your vagina enormously. As we mentioned, that hymen at the entrance gets damaged or broken at some point in most women's lives, certainly with the onset of sexual activity, if not before then. But other than that, the shape and size of your vagina does not alter significantly with sexual activity at all. No amount of sex can ever make your vagina loose. Now, childbirth, as you can imagine, the head of a baby is a lot larger than anything any guy's got going on. That does, for a little bit, stretch the vagina to its larger than usual size. However, it's a muscle, so it contracts back down in the weeks following childbirth, weeks and months. But after a few months, the vagina, generally speaking, goes back to the normal size. It doesn't stay loose even after childbirth, ladies. So nothing any guy's doing to you can possibly cause more damage than that. Now, what can happen to make the vagina feel loose? Those muscles can get weak because normally during sexual stimulation, they squeeze. But if they're weak, they can't squeeze as well. The good news is, though, that we can actually work out our vaginas and you can make them strong again. Even if you've had kids, even if you're in your 80s, everybody can work their vaginal muscles and improve their pelvic strength. You've probably heard of Kegels. Those are one of the many tools we use. If you have significant weakness in your vaginal or pelvic muscles, something you're really concerned about, you should start off talking with your doctor and or a pelvic physical therapist. If it's something you'd just like to know more about, you can definitely Google things like how to do Kegels or pelvic exercises. If you have more questions about those or about anything I forgot to mention right at the beginning, you can put questions in the comments and we'll go over them at the end. I'm not going to go deep into how to do Kegels right now, but those and other exercises can be great at building up the vaginal muscle tone and general pelvic strength. All right, ladies, big question here. How do you know if you have an infection? Is it always like bad pain and really bad smelling discharge? Or is there something else you should be on the lookout for? Well, the good news is that most, but not all, infections have some pretty good signals. A change and increase in vaginal discharge. The vagina normally makes some mucus, as we mentioned. It's usually clear or white. It's usually a small amount, about a teaspoon or less every 8 hours, which is still not nothing, ladies, but it's not a huge amount. That can change at different points in your menstrual cycle, and certainly when you're pregnant, it increases. But if you're not pregnant and you've noticed a large increase in discharge, that could be concerning. If it's changed from your usual clear or white to become gray, yellow, green, those are all concerning signs and you should get them checked out. Certainly yeast can cause a very thick white discharge. I've heard it described as cottage cheese. So if you've got that going on, that's not normal either. A change in smell is another sign that something may not be right. Vaginas do naturally have a smell. So do armpits. So does your hair. Every part of the body has its own normal smell. The vagina is no exception, and that is not a sign that there's anything wrong with it. But if you have noticed a big change in the way you smell, if you've noticed that things suddenly smell a lot worse, that is a reason to go get checked out by your doctor. Any itching, any pain, any sores or blisters, those are definitely a reason to get right to your doctor and get things checked out because those are a huge red flag that something's wrong. Just pelvic pain can also be a problem sign. It's not very specific to infections, but it can be a sign of infection. Certainly if you're having pain outside your usual menstrual cramps, if it's more persistent, if it's in a slightly different spot, if it just doesn't go away, and especially if it accompanies like a change in discharge, you should go get the doctor to check that out for you. A change in bleeding or irregular periods where you didn't have them before can be caused by so many things, but infection is one of them, and it's one thing your doctor will probably check you for if you go in for a visit about irregular vaginal bleeding. However, I mentioned there's some exceptions. Every now and then, infections don't cause any symptoms. So ladies, it is important to get your screening visits even if you don't have any symptoms. When you go for your yearly well woman visit, your doctor should be offering you screening for things like gonorrhea, chlamydia, HIV, possibly syphilis, depending on your risk factors and your exposures. But those things can be asymptomatic for a very long time, even when they're causing damage. So let's say, for instance, a chlamydia infection can lead to infertility and scarring in the uterus and the fallopian tubes long before you ever have symptoms. So make sure you're having those yearly well woman visits, you're getting the appropriate screenings, you're listening to your doctor's recommendations for checks for STIs, even if you're feeling fine. And if you don't have a doctor but you really feel like you need to get checked, the health department does always offer free STI testing. All right, next question. What does a normal menstrual period look like? All women got them if we got a uterus. What's normal, though? Am I normal? What's happening? There's this beautiful little myth of the 28-day cycle with a 5-day period, and some women may have that, but it's only an average. If you don't have a cycle that lasts for exactly 5 days and comes every 28 days, that's okay. There's nothing wrong with that. All women who've gone through puberty and have not yet reached menopause should hopefully be having a menstrual cycle. That is normal. You want it to be about the same length and about the same time apart each time, though a little bit of variability is normal. If there's a big change in that, that's concerning. You should get it checked out. But the periods themselves come in a wide range of normal. The bleeding can last anywhere from 3 to 8 days and be in the normal range. The menstrual cycle itself, how often you have bleeding, can be anywhere from 21 days to 35 days in between the first day of bleeding for each cycle. Now that's a huge difference. 21 days and you could be having 2 periods a month sometimes. It's kind of inconvenient, but it's not abnormal. 35 days, you may go a whole month without a period. As long as you're tracking along, every 33, 34 days, you're still in the normal range. So there is a lot of variability in the possibility for periods. And if you have regular periods that are usually exactly the same or very similar to the same, you're probably pretty normal. If you fall outside of the things I've just said, you probably should talk with your doctor about it. It may not be a serious problem, but it's something they need to know. As I mentioned, a little bit of variation is okay. If your period's normally 3 days, but then it was 4 days one month, back to 3 and then 5, that's not a huge problem. If it's otherwise normal, your doctor's not going to do a lot. They're going to say you're okay. But if you have other concerns or other issues with it, definitely get it checked out. All right, the exceptions to that rule, though. I just said everybody should be having a regular period. There's a few exceptions to that. Girls that are just starting their periods are going to be irregular most of the time, both in the length of time they bleed and in how frequently they have periods, and that is normal. It's just part of the ramp-up period to having a period for the rest of your life. It can take up to 6 years for periods to normalize. I would say most girls by 2 or 3 years after the onset of periods are pretty regular, but up to 6 years is still okay. Periods should stop during pregnancy, so pregnant women should not be having regular periods. Pretty much any bleeding during pregnancy should be talked about with your doctor. I know I've once or twice had a patient tell me, oh yeah, I had my period all through my pregnancy. You did not have your period all through your pregnancy. You may have had frequent bleeding, and that's kind of concerning, but it's not a period. You can't have periods while you're pregnant. Women that are approaching menopause will probably have irregular periods. How can you know it's menopause and not something else concerning? You'll probably be having the onset of menopausal symptoms, things like hot flashes, possibly more fatigue, possibly not, possibly a decrease or increase in sex drive. You can also just ask your doctor, do you think I could be going through menopause? Most women complete menopause around age 51, and it can be a year or two before that. But anywhere from 45 on up is kind of a normal age to start having those symptoms. So if you're right in that age range, you're having hot flashes and your periods have gotten irregular, it's probably the menopause coming. But until you've gone through menopause, you should still be having periods, even if they're irregular. And you can still get pregnant, ladies, so don't take those irregular periods as a sign that you couldn't get pregnant. Other things that cause irregular periods that are not super concerning, birth control. If you've got an IUD, if you have a Nexplanon, a lot of even the oral forms of birth control can cause irregular bleeding, and that's okay. Talk with your doctor about it to make sure that's the cause, but that is a common cause of irregular bleeding that we create all the time. Other medications can also cause irregular bleeding. However, you should definitely talk with your doctor about that and see, is this medication causing irregular bleeding, and is that a problem or not? Some medical conditions also often cause irregular periods, things like PCOS. But again, that's a thing your doctor should be talking about with you and not something you should decide on your own. When does that bleeding end? What's normal? We did mention menopause already. Menopause is complete. You've gone through menopause when you have not had a period for 12 months. So for 12 whole months, no bleeding. When that's happened, you've gone through menopause. You're done. Like I said, usually that happens around 51, but there's a pretty good age range there where it can happen. Over 40, under 60, could happen anywhere in there. Usually between 45 and 55 is where most folks are at. And like I said, average is right at 51. Once you've gone through menopause, what's normal? No more bleeding. Any bleeding after that 12-month period is always abnormal, ladies. It's not your period back. You need to go to the doctor. It may not be a serious problem, but it's a problem. Something's going on and you need it checked out. I say that because up to 1 in 5 women on average that have postmenopausal bleeding may have cancer of some kind. So it's a huge deal. If your doctor finds no problem and says maybe it was just a scratch, maybe it was an infection, great, it's cleared up. You didn't have a major issue, but it always should be checked out. All right. We talked about periods a lot, but they are kind of a big deal for all of us. Let's move on to the next question, next misconception. Is it normal for sex to hurt? Maybe like the first time, right? It's normal for sex to hurt the first time for everybody. Not exactly, no. It's very common. Up to 75% of women will have pain with intercourse at some point in their life. And at any given time, about 20% or 1/5 of women are having pain with intercourse. But that doesn't mean it's normal, ladies. Even the first time someone has sex does not necessarily have to be painful. Now, if that hymen has not been broken, there may be a very small amount of discomfort when that happens. But other than that, it should not be painful. As long as you have adequate lubrication, adequate time for arousal, sex shouldn't be painful. If you are having pain with sexual activity, it means something's not quite right. Maybe you just need more lubrication. Maybe you're not naturally producing quite enough. Maybe you need to change positions or how things are going with your partner, talk with them about doing something a little differently. Maybe you just need more time. Women have to go through a cycle of interest. Yes, I think I'd like to have sex. Arousal. I'm feeling good about sex. And then sexual stimulation where they're enjoying it, and then they can reach orgasm. If you don't have that full spectrum there, you're not going to be able to enjoy sex as fully, and you're much more likely to have pain. If you are having persistent pain, though, either that's persisting even after increasing lubrication, working with your partner, or if it's preventing you from having sexual activity, you should talk with a doctor because that is not normal. All right, so if pain's not normal, well, maybe I'm just not enjoying sex so much. What could I be doing to make sex better? There's so many things out there. This is not Cosmo. This is not hot sex tips, so we're not going to get into graphic detail. But there are a lot of misconceptions, and we're going to talk about those some. So here's 5 of them that I hear a lot, and that are all wrong, ladies, all wrong. So the G-spot. There are so many articles about the G-spot, finding it, everything about it. The problem is that there isn't a G-spot. Sorry, but there's not. The anterior wall of your vagina is very sensitive. And some women may really enjoy having that stimulated, but there is no organ, there is no specific set of nerves that make up a G-spot. So ladies, if your guy just wasn't finding it, it's not his fault. We'll talk later about what is there, what can work, but there's not a G-spot. So that's not going to work. Tips for finding the G-spot are never going to be helping you out. The next myth, intercourse should do it for you. There's something wrong if you're not orgasming with just plain old vaginal intercourse. Absolutely false for about 3/4 of people. 3/4 of women cannot orgasm with vaginal penetration alone and can orgasm with other stimulation. So 9 out of 10 women can orgasm. 1 in 10 women may have other health problems that's preventing that, and those are possibly addressable. But like I said, 3/4 of those women can't do it with just vaginal penetration. So other things are needed. Another thing I hear a lot, I don't know if y'all have seen it everywhere on your Facebook, but oh my gosh, ashwagandha gummies have been everywhere in my feed. I've never bought any, so I don't know why. But they make so many claims about how they're going to get you going, get you in the mood. Neither ashwagandha or any other supplement has good evidence of increasing your sex drive or enjoyment. Now, there are some medications that work, and certainly plenty of things like lubrication and things do increase sexual enjoyment, but there's no supplements that have been approved for increasing your sex drive or sex enjoyment. So don't spend all your money on that, ladies. They're just ripping you off. Let's see, other things that are not true. There's something wrong with you if you need to use lube. Absolutely not. Lube is for everybody. Lube is always a friend. Plenty of people will need lube because they can't produce enough lubrication naturally. The vagina is meant to be self-lubricating, just like it's self-cleaning. Unfortunately, sometimes hormones, even normal healthy hormones, can interfere with that. So women who are post-menopause will pretty much always need lubricant. Women who are post-childbirth are frequently going to need lubricant because of the hormone changes. And plenty of other people just may, at different times of their cycle or day-to-day, need a little lube, and that's normal. Last thing is one of the nastiest myths. Female orgasms just aren't real anyway. They are. They've been, scientifically charted and proven. We know they happen. Gentlemen, if you feel like they're not real, maybe you need to be doing something a little different. But they are real, and as I mentioned, 9 out of 10 women can reach orgasm. All right, so those were the myths. Those are things that aren't real. What is real? What can we be doing? Well, for most women, clitoral stimulation works. For those 9 out of 10 women that can reach orgasm, most of them will be able to reach it with clitoral stimulation. You may have to work with your partner to figure out how that works for you, how to build that into your intimacy, into your sexual activity. But for most women, stimulation of the clitoral area will help them reach orgasm. Different things may need to be done for different ladies to help them out with that. Allowing time for intimacy and arousal. I mentioned the whole process you have to go through to get to orgasm. It really is a process. You need time to do it. You may not be there in 30 seconds or 3 minutes. It may take some more time. But we know that a good relationship with your partner and a sense of intimacy with them outside of sex is one of the hugest predictors of women being able to enjoy sex. So being intimate with your partner, being close to them, and then taking the time you need to enjoy sex is going to help a lot. Communicating with your partner on the same note, making sure you let your partner know if what they're doing isn't working for you. They can't get you there if they don't know they're going the wrong direction. So make sure you tell them what feels good and what doesn't. And then, as I said before, lube is a good friend. There's nothing wrong with needing lube. I recommend water-based lubes for most people. These are generally safe. Any lubes that have a lot of added ingredients like flavors may or may not be right for every person, but things like natural water-based lubes are safe for pretty much everybody. All right, that was 10 misconceptions about vaginal and pelvic health and what's false and what's true. Let's see if anybody had any questions for us as we kind of race through all of that. Allie, have we got any questions today? No, all right. Well, I must have just answered all the questions. That's fantastic. Well, if you think of any questions later, you're welcome to add them under this video. This video will stay posted on the memorial page, and it'll go up on YouTube so that you can come check it out later again or show your friends. I hope you're all having a great day. If you have concerns about your pelvic or vaginal health after everything we've talked about, please talk with your doctor. If you need a doctor, please give us a call over at Memorial Medical Group on Astor Street. Our number is 480-8900. We'll be glad to get you in and get you fixed up. Y'all have a great weekend. Bye.